And are we recording? All right, looks like we are. Hi, everybody. My name is Hakeem Youssef. I'm a third-year med student here at the University of Vermont, and today I'll be giving a talk on learning more about teledermatology. So I hope you enjoy. Without further ado, I'll go ahead and get started. Oops. So first off, what is teledermatology? So teledermatology is the use of telemedicine to assess, diagnose, and treat conditions of the skin, basically what it sounds like. And dermatology lends itself particularly well to this new growing era of telemedicine for a couple of different reasons. One, the skin is easily viewed and imaged, and oftentimes all you need is that view of the skin to be able to come up with the next steps. You hardly ever need to do something like draw labs or something like that, for example. Most cases are non-emergent and non-urgent. Probably don't need me to tell you why conducting something like an emergent ER visit over telemedicine probably is not a great idea. There's a high prevalence of skin disease in America. 1 in 4 Americans deal with skin disease. That means there's more Americans with skin disease than there are with diabetes, or there are with cardiovascular disease. So, it's highly prevalent. We've all probably dealt with it in one form or another. And just by the sheer numbers, all the people with skin disease and all the telemedicine going on, you're bound to have to treat it and deal with it over telemedicine. And then poor access in some areas, and that's not just a problem here in Vermont, but all over the United States and all over the world, even. And really, that's where the potential of teledermatology and telemedicine in general is, in being able to bridge that gap and increase access to care to many people who normally wouldn't have it. So yes, teledermatology comes really in 3 different flavors. There's real time or live interactive, and that's basically what you would think of when you think of your typical Zoom video chat with a patient. There's store and forward, and that's basically where someone can take a picture of a lesion and send it off, usually to a provider, and then the provider can look at it whenever they can and get back to whoever sent it, maybe the same day, maybe the next day, whatever it is. It's kind of like sending an email or a text message. There's no live component. It's kind of just send it and wait and get back to each other. And then third is the hybrid, which is basically a combination of the two. And from speaking to some dermatologists, this is actually probably what works best. And we'll find out why that is in just a few slides, actually. So now we'll get into some ways to optimize your teledermatology visits. And so here's kind of what we're talking about with the hybrid. So uploading a high quality image, or having your patient upload a high quality image through MyChart before the patient visit can actually be super helpful. And that's for a couple of different reasons, mainly the camera. So if you're going to be video chatting with a patient, they're probably going to be using the front facing camera or the selfie cam, also called the webcam. And they're probably going to be using that for the visit, and that the quality of that camera is usually much worse than the quality on the back of an average smartphone. And so if you can, here's an example of that right here. So here's someone who took 2 pictures, one with the one with the back facing camera and then one with the front facing camera. And you can kind of see the difference in quality here between the 2 images. And you can imagine if you were a provider, which lens would you kind of rather look through at a skin condition and try to treat it? And you can make out the fine details much better with the picture on the left than the picture on the right. And having that still image also helps to appreciate these fine details. That's another reason why having a picture before the visit lends itself super nicely. And you can see the difference here. And this was taken with the iPhone 10, which came out in the fall of 2017. So since that time, smartphone cameras have gotten even more sophisticated, but basically the difference between the front and the back facing camera of any smartphone is basically what you would see here. And so that's why the back facing camera is just far superior for imaging. And the same applies for the webcam or the selfie cam for a tablet or a computer. It's just as low quality. And so that's why it's good idea to try to have your patient take an image beforehand. And one dermatology who specializes in teledermatology even told me having a high quality image is oftentimes just half the battle with teledermatology. Once you have that image, it's kind of downhill from there. The medicine part isn't the hard part. It's the being able to get a good look at what you're trying to treat is actually the hard part. And logistically, for a lot of reasons, this doesn't always happen. Having a patient upload an image just because it may be difficult, especially for the patient to take a picture of a lesion that's in a hard part to image. You can imagine like if it's something on your face and trying to take a picture with the back camera of your phone, you can't really see where you're taking a picture of, so that's difficult. Or the lesion might be somewhere else on your head or somewhere else where you can't really take a picture of, and you need someone else to take it for you. And a lot of patients live alone, that kind of thing. So it doesn't always happen, but that's kind of just the ideal scenario. Now we'll get into some other kind of general tips before getting a little bit more specific, but there's this great website called dermpics.com where they kind of show you a stepwise way to take a picture for teledermatology, kind of to use for teledermatology. And these tips lend themselves over well also for video conferencing. So we'll kind of go through some of these, and we'll start with taking photo in a well-lit area without flash. Now, the without flash part might be a little counterintuitive, at least it was to me. But when you use flash, that can actually alter the light distribution and the white balance and kind of create an image with a color that's different than actually would be seen with the naked eye. And I have an example of that right here. So you can see this picture of this table, both with flash and without flash. And you can see how with flash, it kind of takes on this brownish color, but without flash, to the naked eye, it's more of this orangish color. And that's basically what we just talked about. And it's why you want to avoid flash when imaging skin lesions, because it can give it a different color. And anyone who's taken flash pictures before probably has seen this effect to some extent at one point or another. So just be mindful of that. And then other tips, avoid selfies if you can, for the reason we just talked about with the front facing camera not being high quality. Another tip is if you're going to be taking an image with the back facing camera, you can tap on your screen to focus. So if wherever you tap, that will put focus on that area in the image. And so try to tap the area of the lesion, and then don't use the zoom feature. It's a pinch to zoom on most smartphones. When you do that, you sacrifice image quality and resolution. So that's something to try to avoid also, just because we're trying to get the highest quality pictures we can. And some things to avoid, these are pretty obvious: bad lighting, poor focus, and then busy background. So when you have a lot of different colors in the background, it makes it hard to kind of key in and focus on the lesion. So avoid that. And we'll talk about what backgrounds work best in a couple slides. And for skin lesions, basically for imaging purposes, it helps to think of all skin lesions as falling into, or most skin lesions as falling into, one of four categories. You can either have a rash, you could have a skin spot, which would be like a mole or seborrheic keratosis or skin cancer or something like that. You could have acne or rosacea type lesions, and you could have lesions on the hair and the scalp. And not always 100% true, but most skin ailments can kind of fall into one of these four categories. And it's helpful to think of them like this in these four categories, because each category has their own kind of best way to image. And we'll kind of go through some of those right now. So we'll start with a rash. So when you have a rash, it helps to take two types of views. And this will be true for all lesions, but you want a view from distance and you want a close-up view. And then if the rash is in a normally covered area, have the patient remove the clothes so you can fully see the rash. And so we'll start with the distance image, and this is mainly for the distance view. If you're on webcam, this is mainly to get an overview of the rash and see its location and how far it extends to and what body parts it extends to. And so you want to try to get good lighting like we talked about. You want to turn off flash like we talked about, and then you want to use a solid background like we kind of talked about. And what they found is that solid blue or white actually works best. So keep that in mind. And then for the close-up, so ideally you want to be 6 inches away from the lesion. You want to try to frame the lesion inside the screen, and you want to keep the spot in focus. So we kind of talked about some of those already. And then next we'll talk about photos of a spot or imaging of a spot. So once again, you want to have a distance view, and then you want to have a close-up view. And for the distance view, what helps is marking the lesion of concern. You can do that with like a marker or pen or anything really. And that just makes it easy for the provider who's looking at the imaging or the video or the picture to key in on where the lesion of concern is. And then another thing is defining relative size. So here they're using a penny, any type of coin works great. I've seen tape measures used, basically anything where the provider can kind of get an idea of how big the lesion is, because otherwise if you just have a lesion kind of free floating in space, it's hard to make out, it's how big it is and its dimensions and how really how far it extends to. So it's another good tip. And then for the close-up view, once again, you want to be 6 inches away. You want to keep the lesion centered, and then you want to maintain focus, all things we've kind of already talked about. And then next, we're going to talk about some acne and rosacea lesions. So once again, distance view and close-up view, and we'll start with the distance view. So you want to have the patient, at 3 different head positions just so you can fully see the face. So you want the patient to be looking straight away, and then you'll want the patient look to the right, and then patient look to their left, just so you can get an overview of the entire face, kind of like a mug shot, but for a slightly different reason here. And you want to have good lighting, like we talked about, blue or white solid background, like we talked about, and then don't use flash, like we already talked about. And another thing just to remember when you're imaging, for example, acne, usually it doesn't just involve the face, it tends to also involve the shoulders and the upper chest and upper back. So don't forget about those and have the patient show you what those are looking like, or that area is looking like. And then next, the close-up for an acne or rosacea lesion. Once again, you want to be 6 inches away. You want to keep the image in focus, and you want to use good lighting, all things we've talked about. You guys are probably pros at this by now. And you can really, if you look at these 2 images, you can really appreciate the severity of the acne because the image quality is so high. You can kind of see, the little, the pustules and the scars and what's the word? The kind of crater scars and box cut scars here. So that shows that why having a high quality image can really make a difference, because without this high quality image, maybe you wouldn't be able to appreciate the severity of this acne. And sadly, you might be more used to looking at something like this on your video chat visit. So you can really see, obviously this is probably a little less in severity compared to this acne, but you can really see the difference, and you can see how having a high quality image can let you see a whole lot more. So that's something to keep in mind, and something as we move forward and hopefully implement in your practice. And then next we'll talk about hair and scalp concerns. So once again, distance view and close-up view. So you want to use a solid blue or white background like we talked about. You want to expose the involved scalp, and then you want to use a comb or pencil to expose the spot and dense areas. And then the scalp is always super difficult to image, just because it's hard for the person who's doing this to also take a picture. And when you're taking the picture, it's hard to see what you're taking a picture of because you're kind of over your head. So logistically, the scalp is super difficult, and we'll talk more about that when we get to the logistics and considerations and things maybe that aren't great for teledermatology. But as we keep going, so for close-up, once again, you want to be 6 inches away. You want to capture redness and flaking, and then you want to keep the scalp in focus. And yeah, you can see here the scalp is, it's tough to kind of see what color it is, what color the lesion is, and you have all this hair going on. So yeah, scalp is not very easy. And once again, we'll talk more about that in a little bit. And additional things to avoid, once again, poor lighting, blurry image. You can see how if you had this image here, you can't really do anything with it because it's just a blur and there's hair all over the place, and then not fully exposing the scalp. So yeah, that's probably if you're trying to take a picture of your own scalp and the lesion, you'll probably get a picture like this. So once again, logistically not easy to image the scalp, especially on your own. And now we'll just talk about some effectiveness. Or the effectiveness of teledermatology. So when I started preparing for this talk, I was kind of going through PubMed one by one, looking at individual studies to look at the overall effectiveness of teledermatology. And what I was finding good studies that were showing, if not 100% effectiveness or agreeability to in-person, pretty close to it. And slowly I realized that there were so many studies that were showing that, and there was probably over at least 100 studies that I didn't read them all, but I could see that there was just tons of studies. And so what I did was I went to the American Telemedicine Association, and they make practice guidelines for dermatology, and not just teledermatology, but all forms of telemedicine. And in it, they say here, teledermatology has been found to be reliable for accurate diagnosis and treatment plans for skin disorders. And here you can see they cited 36 different studies. And there's a whole lot more than that, especially when you factor in that this came out in 2016. And let's keep reading. So with some exceptions, the preponderance of the evidence confirms the diagnostic accuracy of teledermatology compared to in-person encounters as our management and treatment recommendations. And we'll talk about what some of those exceptions are in a little bit. And then clinical outcomes and quality of life measures are similar as well for telemedicine and in-person care. Moreover, patients, referring clinicians, and dermatologists have expressed high levels of satisfaction with teledermatology as it facilitates access to dermatologic expertise for patients who are geographically or logistically challenged. And as you can see here, a whole ton of studies cited, and I'll leave the link to this in my works cited if you're curious. But yeah, no shortage of evidence here showing the efficacy of teledermatology. And just some scenarios on where teledermatology particularly works well. And I found these out by talking to some dermatologists who do teledermatology on a normal basis. And so the first area where teledermatology really shines is triaging. So more of a, if you have a patient with a rash, something like, okay, it looks like this, this is pretty safe. We'll try this topical steroid. And if it doesn't get better in 2 weeks, we can have you come in or go see dermatology or try something else. So more of like a triaging, we'll try this and see and wait, as opposed to a definitive kind of visit. Like if a patient just has skin lesion and just wants thinking of it as a definitive visit, the same as like an in-person visit would be, it probably makes more sense to think of it more as like a triaging tool. And then for follow-up, works great for follow-up is what I'm told, because, ideally you would have seen the patient before and, seen their lesion and you know what they have and you have your bearings. And so if it's like, if you're treating acne, for example, and the patient, and prescribe something and the patient just wants to follow up in 2 weeks, say, hey, it's getting better, or it's not getting better. It's a quick, if it is getting better, it can be like a quick 5 minute, video chat saying, hey, look, it's getting better. And you already know what it looks like. And you can see that it is getting better, as opposed to having the patient, take off from work or take off from school and have to come into the office, and saves you time from having to make a full office visit just to have a quick, couple minute video chat. So that's really where it works well. And in that example, you can see why it's, something like teledermatology does increase patient and provider satisfaction, like we saw in the last slide on the American Telemedicine Association. So something that to keep in mind, and something where you can see where teledermatology is especially useful. And then so special considerations and limitations, areas where teledermatology may not be the best way to go about things. So once again, the American Telemedicine Association, in their practice guidelines, they talk about some of these. So the first, a full body exam. So you can imagine if you're trying to do a full body skin exam, how difficult that would be, both either on video or with cameras, almost impossible, just because you can't really get the whole body in sufficient enough detail that you're looking for, especially in a full body skin exam where you're going to be on the lookout for smaller lesions and harder to see lesions. Next, hair bearing skin. We kind of already talked about this a little bit, but the scalp is just super difficult to image with all the hair and the change in color up there and that kind of thing. And logistically, just having a patient try to image their own scalp. So it's another thing that's not easy to do over teledermatology, and maybe better in person. Pigmented lesions, and this is just because you always, when you're looking at pigmented lesions, you kind of always want to have a high index of suspicion, just because they can be something dangerous like a skin cancer. And so it's basically just saying here that if you have a pigmented lesion, you may not get the best look over teledermatology, and you always want to be safe than sorry when it comes to those. So another thing where maybe in person is better. And then mucosal lesions, you can probably imagine why that you can probably imagine there are much better ways to kind of go about mucosal lesions than probably having a patient try to stick a camera inside their mouth. So yeah, and also same with mucosal lesions in the genitalia. So once again, not something that might be the easiest thing to do over teledermatology. And then skin color, this is kind of just saying that, if over video and with different lighting, the skin may appear differently than what actually to the naked eye. So that's something just to keep in mind and to consider whenever you're doing a teledermatology visit. And then just a quick thing on primary care provider attitudes toward teledermatology, aside from the ones I was able to gather in clinic, where basically all the family practice doctors I worked with liked using teledermatology, will continue to use it, do use it. And so here's just some studies I was able to find to add to that. So in this study here, in this urban environment, community health center, primary care physicians, I think this was in Boston. were surveyed on their opinions of teledermatology, and you can see here that 100% who had prior use of teledermatology were interested in reusing it again. So there's that. And then here's another study, came out also in 2015, just like the last one, where it also asked primary care providers perceptions of this time mobile store and forward teledermatology. And you can see here that 100% agreed or strongly agreed that teledermatology increases access to dermatologic care, improves patient care, and is accessible to patients. 100% agreed or strongly agreed that teledermatology provides educational benefit to the PCP. So those are the only studies I could find on primary care provider attitudes toward teledermatology. But you can see here that it's pretty well liked. And to add to that, this was all before our new rise in telemedicine, so you can probably assume it's probably even higher now. But anyways, lastly, I'm just going to talk about some other avenues of teledermatology, and namely e-consult. And now I'm not sure where exactly this stands at UVM. I know it's kind of a new thing, and it was kind of undergoing this pilot program. And so I'm not sure if everyone has access to it, but from the providers I was able to speak to in clinic who have used it, they love it and speak super glowingly of it and use it all the time. So basically, let me just show you how it works. So if you're in a patient's chart, you can hit add order at the bottom, just like you're adding an order in general, and you can type in derm and hit enter. And then this thing will come up, and it'll be the second one. It's called ambulatory consult dermatology. You can click on that. It'll basically have you upload an image, and you can use the same tips and tricks we learned in this earlier in this talk to upload a high quality image, and then it'll ask for like a little blurb, a little bit about it when it starts, that kind of thing. And then you kind of send it off, and then I've been told you usually get a dermatologist will usually get back to you within 48 hours. And yeah, the providers I spoke to love it and use it all the time, and think it's super efficient and has the potential to increase the efficiency of medicine, because I think the hospital is trying to roll this out not just for dermatology but all specialties. And you can see why that would be super super convenient, especially as a primary care provider. Instead of having to send off the patient to someone else, maybe just having a quick consult like this would work better. And I've heard reimbursement is the same or similar, so that's good too. And yeah, you can imagine, if you have an X-ray and you're not sure what to do, maybe you could just consult orthopedics or radiology or something like that and get a quick answer as opposed to kind of stringing the patient along. So a lot of promise here, somewhere where teledermatology can also make a big impact. And yeah, lastly, just a summary and some take-home points. So teledermatology is an incredible tool. When used properly, has the potential to improve access to care. Having a patient securely upload a high quality photo to MyChart before video conferencing can be very helpful, like we talked about. Teledermatology can be more thought of as a triage tool in many cases. It's helpful to think of it that way. It's also great for follow-up visits. And then lastly, not all skin visits lend themselves nicely to telemedicine. We talked about some of the limitations, so know those, and use best judgment and that kind of thing, and kind of have the patient on board with, hey, this is how we're going to do it, we're going to try this, and more of a triaging tool. So yeah, otherwise I think that's about it. Here are my references in case you're curious. And yeah, I hope you enjoyed, I hope you learned something, and thank you everyone for listening. See you guys later. Bye.